Welcome back, everybody, for another deep dive. This time, we're going to be talking about something that I'm sure you're all familiar with, the physical exam.
Oh, absolutely, yeah.
It's one of the cornerstones of patient care. But
Yeah.
in a world of, like, all this crazy new technology and stuff,
Right.
it's easy to wonder, like, does
Yeah.
it really still have the same kind of weight?
Well, I think what's so fascinating is that we have this wealth of knowledge literally at our fingertips.
Yeah.
But it's easy to be, I guess, enamored by all the technology and all that it can do.
Totally. Like, a CT scan can show you a tiny little fracture, but can it tell you
Exactly.
how the patient winces when you palpate their arm?
Right. Or how their skin feels. Is it clammy? Is it cool?
Right.
Is it, warm?
Yeah.
And so that's what we're diving into today, the unique value of the physical exam, not as something that's archaic or in the past,
Right.
but as a partner to technology.
Yeah. And one of the things that I thought was really interesting was this idea of treating physical exam findings like their own diagnostic tests.
It's a game changer, isn't it? I mean, think about this. We always look at labs. We look at, different imaging results. But what if we look at a positive Babinski sign?
Yeah.
Or, a palpable spleen? What if we look at those with that same lens?
Right. So instead of just being like, oh, the spleen feels large, it's like, okay, well, a palpable spleen in this context, based on studies, has this likelihood ratio for this condition.
And there's been some really neat research that's come out, particularly in academic medicine. And what they did was they actually showed that specific physical exam maneuvers,
Wow.
like looking for edema in the lower extremities, had a high sensitivity and specificity for heart failure.
Wow.
So it's not just, oh, I have a hunch that this person has heart failure. There's actual data behind it.
Right. And that's huge for nurses because it means that what we're seeing and feeling has diagnostic power. And so it elevates our role in clinical decision-making.
Absolutely. I think it's all about taking those pieces and putting them together. The technology, the labs, the physical exam findings to really get to the root of what's going on with our patients.
Yeah. So, I know from my own student days and things that sometimes you're doing a full head-to-toe exam.
Right.
And then sometimes you're really just zeroing in on a specific area.
Right.
And our sources talked about this difference between a comprehensive and then a focused exam.
And I like to think about it kind of like you're using the right tool for the job.
Yeah.
A comprehensive exam, when you first meet someone, it really allows you to get that full picture of the patient, their overall health,
Right.
Establish rapport.
Yeah.
And you pick up on those subtle clues that maybe initially you don't recognize.
Right. So it's kind of like you're getting to know the patient.
Absolutely.
They're building that relationship.
Yeah.
You're getting all this information.
Yeah.
But what about like someone who comes in with a very clear-cut ankle sprain, right?
Yeah.
You don't necessarily need to do that whole head to toe.
Exactly. And that's where the focused exam comes in.
Okay.
So you're laser focused on, that ankle.
Right.
But you're also thinking about, how old are they?
Yeah.
Do they have any pre-existing conditions?
Right.
Anything that could complicate the picture.
Yeah. So even when it's focused, you're still doing all that
It's absolutely
critical thinking.
Always, yeah. You're constantly analyzing, adapting. It's why it's such an art
Yeah.
as much as a science, this physical exam.
Totally. And speaking of art, our sources talked a lot about the human element
Yes.
of the exam and how we interact with patients can make all the difference.
I think it's important to remember that it's not just what we do, but it's how we do it.
Right.
And to think about when you're asking a patient to expose parts of themselves, to be in a vulnerable position,
Right.
that's a very personal space that we're entering.
I remember this one time I had a patient who was super anxious about a breast exam.
Oh, sure.
And just by dimming the lights in the room, explaining everything that I was doing, making sure she was properly draped, I could see her visibly relax.
Absolutely. You created a safe space that allowed you to not only have that relationship with her, but to do a more thorough and accurate exam.
Yeah, exactly.
Which is so important.
Yeah. And it's also about paying attention to those nonverbal cues too, right?
Mm-hmm.
Like a grimace or a flinch or even a sigh. Those things can tell you so much.
You're reading between the lines of the body, which often speaks much louder than maybe what the patient's saying verbally.
Right. And as students, I feel like we're so lucky that we get to learn from nurses.
Absolutely.
Who have been doing this for years and years.
Watch them. Watch how they position themselves, how they use their hands, how they talk to the patients. Those subtleties are gold.
Yeah. And speaking of good practices, we can't forget about the safety aspect of things too, right?
Always safety first. And,
Yeah.
we're talking about, standard precautions. We're talking about hand hygiene,
Right.
using PPE when appropriate, proper disposal of sharps, all those things.
Right. And the CDC guidelines are very clear about that. Like hand washing with soap and water when your hands are visibly soiled, using alcohol-based sanitizer otherwise, and then, gloves and other PPE whenever there's a risk of exposure.
Absolutely. And you know what? These guidelines protect us. They protect our patients.
Right.
And they're non-negotiable.
Right.
It doesn't matter what clinical setting you're in. These are the things that are essential.
Absolutely.
Wow.
So we've kind of established, like, the physical exam is still relevant. It's essential. But, like, how do we actually do it?
Right.
And our sources break down those 4 classic techniques.
Yes.
Inspection, palpation, percussion, and auscultation.
These are our bread and butter. These are the fundamental tools that we have. And they allow us to kind of tap into a different sense.
Yeah.
To give us a multidimensional picture of what's going on.
Right. So inspection, I feel like, is like visual detective work.
It is. It's visual detective work.
Yeah, you're really looking at everything, like the color, symmetry, any unusual markings, like anything that just kind of pops out at you.
And it's more than just looking. You have to think, is this normal for this patient's age?
Right.
For their ethnicity, for their medical history?
Right.
Does anything seem out of place?
Yeah. So, like, if I was inspecting a patient's skin, I'm not just, like, noting that there's a rash.
Yeah.
But I'm also thinking, like, okay, well, what kind of rash is this? Like, what's the distribution? Like, does it blanch?
What about the nonverbal cues from the patient? Are they scratching it?
Right.
Are they trying to hide it?
Yeah.
All those things matter.
Right, because those things can really guide your next steps.
Absolutely. You're gathering clues. Yeah.
To solve the puzzle of what's going on.
I love that. Yeah. It's like you're putting all these pieces together.
Absolutely.
So we've used our eyes, right? We've done inspection.
Yes.
Now we're going to bring in our sense of touch with palpation.
Ooh, yes, palpation. So this lets us go a little bit deeper, literally.
Yeah.
And we're feeling for things like texture, temperature, tenderness, the size and shape of organs.
Yeah, it's like our hands become diagnostic tools.
Absolutely. Imagine palpating the abdomen. You know, you're not just feeling for a mass. You're assessing muscle tone.
Right.
Are they guarding?
Right.
Are they rigid?
Yeah.
Any of those things.
And it's crazy, like, how those subtle differences in how tissue feels can be.
It can be the difference between, is this liver firm and nodular, or is it soft and smooth?
Right. Exactly.
So it can really guide our decision making as well. Right. And I remember learning about all the different palpation techniques in school, like using your fingertips for fine discrimination.
Right.
The palmar surface of your hand for bigger, broader assessments.
So choosing the right technique for the task at hand.
Yeah.
And remember, palpation is not just about finding the abnormalities.
Right.
It can also be very reassuring to the patient.
That's so important. Yeah, just that gentle touch.
Absolutely.
A reassuring word. It can really go a long way in easing anxiety during an exam.
Absolutely.
Okay.
Now, how about we add in another sensory layer? Listening.
Okay.
Percussion.
Oh, percussion, yeah.
This is where things get really interesting.
I'll admit, percussion always kind of felt a little bit mysterious to me as a student.
Yeah, I can understand that.
Like, I'm tapping on someone, and that's going to tell me what's going on inside.
It's like sonar for the body. By listening to the echoes, you can actually tell the difference between air, fluid, and solid structures.
Wow.
So, like a dull thud over the lungs might indicate pneumonia, whereas a resonant sound might be normal.
Right. Okay.
And in the abdomen, a very tympanic or drum-like sound could mean that there's excess gas.
Okay.
Whereas a dull sound could mean that there's a mass or fluid buildup.
So it's amazing how much those subtle those sound differences can.
It takes practice. You have to kind of tune your ear. But once you master it, it's incredibly valuable.
That's so cool.
Yeah.
Okay, now let's talk about the one that I think, even people who aren't in healthcare are familiar with. Auscultation. Listening with our stethoscopes.
Yes. And this is where we get to hear the symphony of the body.
I love that.
The heart beating, the lungs breathing.
Right.
Even the gurgling of the intestines.
Yeah. And when we're listening to the heart, we're listening for that lub-dub, that rhythm.
Right.
And then any extra sounds that might indicate a problem with the valve or something like that.
And don't forget about murmurs.
Yes.
Those swishing sounds that can indicate turbulent blood flow.
Right, and then there's listening to the lungs and those breath sounds, wheezes, crackles, raunchy can tell
Too much.
it's not
It's like you're deciphering a code.
Yeah.
You know, a high-pitched wheeze might signal asthma, whereas
Right.
coarse crackles could point to pneumonia.
Right.
It's amazing.
And I feel like as you get more experienced, you can really start to differentiate between those subtle variations in the sounds too.
Your stethoscope becomes an extension of your senses, and you're able to pick up on things that you wouldn't otherwise.
Wow. So we have all these fantastic techniques, but like, how do we actually approach the exam?
Well, you know, our sources really emphasize the importance of having a systematic approach.
Okay.
You know, think of it like building a house. You wouldn't start with the roof.
Right.
You need a solid foundation. You need a framework.
Yeah, that makes sense.
And so the recommendation is really to use that head-to-toe approach.
Okay.
Start with your general survey, check the vitals, and then move systematically through each of the body systems.
Okay. So you're not missing anything.
Exactly.
Yeah.
And you're also minimizing position changes for the patient,
Right.
making it a little bit more comfortable for them.
Right. You don't want to be asking them to like sit up, lay down, turn over
Yeah.
constantly.
Exactly. Exactly. But remember, flexibility is key. There are going to be times when you need to adjust the order based on the patient's condition
Right.
or their concerns.
Right. Like if someone's coming in with severe abdominal pain,
You got it.
you're not going to start with the head and neck.
You're going to go right to the source.
Yeah, you're going to go right to where it hurts.
Exactly. So it's all about using that clinical judgment
Right.
to really tailor it to the individual patient.
Right. And, and real world nursing isn't always textbook perfect, right?
No.
We're dealing with patients in all kinds of
Oh, absolutely not.
situations. And so sometimes we have to adapt.
You're going to have patients who are bedbound, wheelchair-bound,
Right.
obese, postoperative, in pain, on isolation precautions. The list goes on and on.
All right. So how do you still perform a thorough exam
Right.
while respecting the patient's limitations, but also ensuring their safety?
It really requires you to think critically and creatively. I remember early in my career, I had a patient who was morbidly obese.
Okay.
And a lot of those standard exam techniques were very challenging.
I can imagine, yeah.
Yeah.
So how did you adapt?
You know, I had to modify my positioning. I had to use different lighting to improve visibility.
Okay.
And I really had to rely on my palpation skills to try to assess for any underlying masses or
Right.
tenderness.
Wow. So it's really about thinking outside the box.
You do. Every patient is unique. And I think that's what makes nursing both challenging and so rewarding.
Totally.
Yeah.
Yeah. Speaking of challenges, let's talk about documentation.
Oh, yes. Documentation.
I know it's not always the most exciting part of nursing, but it is so
It's so huge.
important.
It really is.
Yeah.
You know, your documentation is your legacy.
Yeah.
It is the record of your assessment, your observations, your clinical reasoning.
Right. And our sources talked about the importance of, clear, concise, accurate documentation.
Absolutely.
Using standardized headings, avoiding all that jargon.
Think of it like you're telling a story. You know, you want to paint a picture of the patient's condition.
Yeah.
So that anybody who reads your notes
Right.
can really get a good sense of what was going on.
Right. It's not just like putting down data. It's like
Yeah.
you're conveying the story of the patient's health.
Absolutely. And remember, it's a communication tool.
Right.
It's how you share information with other members of the healthcare team.
Yeah. So you've done your thorough exam,
Mhm.
you've documented your findings. Like, what's next?
Well, then it's time to synthesize.
Okay.
What does it all mean? What are the key takeaways?
Right, because we're not just collecting data. We're
Yeah.
analyzing it, looking for patterns, connecting the dots.
It's like putting a puzzle together.
Yeah.
You've got all these pieces. Now you have to figure out how they fit.
Right. And I feel like that's where you get those aha moments. Like you're really starting to understand
Absolutely.
the patient's condition, and
Yeah.
it really helps guide your interventions.
And that's where the magic of the physical exam comes in. It's not just a checklist.
Yeah.
It's a journey of discovery. It's a conversation between you and the patient's body.
I love that.
And you're using your senses, your knowledge, your intuition
Right.
to uncover these subtle clues that can really make all the difference.
Yeah. It's so true. And as we've seen, like even in this age of, fancy technology,
Hmm.
those clues are more valuable than ever.
Absolutely. They are.
Yeah.
Absolutely. And it really is amazing, to think that even though we have all this technology, sometimes it's those little subtle clues that you pick up with your senses, with
Wow.
your hands, with your ears, with your
Right.
eyes, that can really help you
Totally.
hone in on what's going on.
So we were talking about kind of synthesizing all of the information, but like we haven't really talked about what happens after you do the exam and document your findings. Like what's the next step?
Well, the next step is you got to put it all together.
Okay.
You have to take all those pieces of data, all those findings, and then really analyze and think, okay, what does this all mean?
Right. Because we're not just collecting data. We're looking for patterns and trends and trying to like put all those pieces together.
You got it. And then based on all of that, you come up with, your assessment.
Right, exactly.
So the physical exam, the labs, the vital signs, everything.
Yeah, all those things, it all fits together.
Right.
Okay, so we've kind of gone over, what the physical exam is, why it's important.
Right.
But like, how does that all relate back to nursing, and why should our listeners care?
Well, I think as nurses, we are really at the forefront of patient care.
Right.
We are the ones who are spending the most time with the patients. We're the ones who are, doing those head-to-toe assessments.
Right.
And so we're in this really unique position to pick up on those subtle changes, those things that maybe, wouldn't be caught if we weren't doing those regular exams.
Right. And that can make a huge difference in patient outcomes.
Absolutely. I mean, think about it. Early detection is key.
Yeah.
Whether we're talking about skin cancer or a new heart murmur or a change in neurological status, our thoroughness, our attentiveness, it can literally save lives.
That's huge. So it's really about being advocates for our patients.
Absolutely. It is. It's about using our knowledge, using our skills to really, make sure that they're getting the best possible care.
Yeah, that's amazing. So, we talked a lot about the science of the physical exam, all the different techniques and things, but what about the art? Like, what are some of the more nuanced aspects that maybe aren't always taught in a textbook?
I think a lot of it comes down to intuition and experience. That feeling you get when something just isn't quite right.
Right.
You can't always put your finger on it.
Right.
You just know that something's off.
It's like that gut feeling.
Exactly. And I think it's so important to listen to that.
Right.
To trust your instincts.
Yeah. What would you say to like a newer nurse or a nursing student who, maybe hasn't developed that intuition yet? What advice would you give them?
I would say be present.
Okay.
Be mindful. Really pay attention to the patient in front of you.
Right.
Not just their physical symptoms, but their demeanor, their body language, how they're interacting with you.
And ask questions.
Absolutely. Don't be afraid to ask questions.
Yeah.
If something doesn't make sense or if you're not sure about a finding, ask.
Yeah, because that's how you learn.
Exactly. And the more you practice, the more you see, the more you'll start to develop that intuition.
Yeah. So, obviously, we can't cover everything about the physical exam in one deep dive.
Right.
But we've kind of hit the main points. We've talked about the techniques, the importance, how it all ties back to nursing.
Right.
What are some key takeaways you would want our listeners to think about?
I think the biggest takeaway is that the physical exam is not a relic of the past.
Okay, yeah.
It is still so relevant, and it is so important. And it really does provide us with that valuable information that we can use to guide our care.
Right. And it's not just about the data. It's also about that human connection
Absolutely.
that we make with our patients.
It's about building trust.
Yeah.
It's about showing them that we care, that we're listening. And in today's healthcare environment, that is more important than ever.
That's so true. So as we move into the last part of our deep dive, let's talk about the future.
Okay.
Technology is constantly evolving. We have all these new gadgets and gizmos coming out all the time.
Right.
Like, where does that leave the physical exam?
Well, that's a great question. I mean, we have these portable ultrasounds. We have AI that can listen to heart murmurs now. We have these wearables, these sensors that are tracking every bit of data. So it really does make you wonder, like, where does that leave the physical exam?
Right, exactly.
But I think what's so reassuring is this: even the most sophisticated AI, it can't replace the human connection.
I love that, yeah.
That is at the heart of the physical exam.
Yeah, and that's something that really stuck out to me from all of our sources, was that, the exam is so much more than just collecting data.
Absolutely.
It's that moment of trust that you build when you're, listening to someone's heartbeat, you're palpating their abdomen, you're looking them in the eye. It's
intimate.
Yeah.
It's vulnerable. And in a healthcare system that can often feel rushed and impersonal,
right,
that human touch becomes even more vital.
Yeah. One of our textbooks actually argued that the physical exam is a form of therapeutic communication in itself.
Think about it. You're literally laying hands on the patient. It's not just a machine.
Right.
You're, feeling their temperature, you're feeling their muscle tension, you're feeling their pulse.
Right.
It's this very powerful nonverbal exchange.
Yeah. And I think it really sends the message to the patient that, like, I'm here, I'm present, I'm listening to what your body is telling me.
Absolutely. And especially now in this age of anxiety where patients are, going online and they're bombarded with all this, maybe scary medical information,
Right.
to have that reassurance from a skilled nurse,
Yeah.
I think is invaluable.
Absolutely. So as we wrap up our deep dive into the physical exam, what's like the one key takeaway that you really want our listeners to walk away with?
I want them to walk away remembering this. The physical exam, even in this age of incredible technology, remains a cornerstone of patient care. It is a source of data that complements the high tech, but it's also that bridge to human connection, to trust, to the art of healing.
Beautifully said. And to all of our nursing students and faculty out there, keep honing your skills, stay curious, and never underestimate the power of your hands, your senses, and your heart.
Absolutely.
And here's a final thought to ponder. As technology continues to evolve, how will you ensure that human element of the physical exam remains strong? Until next time, keep diving deep.